Welcome, and thank you for joining us for our Kirby Virtual Expo. I'm not sure if many of you may have attended our Expo at Kirby Center in our auditorium once again this year. Because of our concerns around your health and safety, we are doing it virtually. And over the next two weeks, we'll be presenting a series of online presentations by some of Calgary's leading providers of information and services, featuring a wide range of topics that will help you maintain a healthy and rewarding lifestyle and to live your best life. Today, we are very pleased to feature 50 years of daydreaming, ADHD in later life, and welcome Dr. Brandi Callahan. Dr. Callahan received her PhD in clinical neuropsychology at University Laval and completed postdoctoral training in Quebec City and Toronto. She is currently an assistant professor of psychology at the University of Calgary and Tier 2 Canada Research Chair in adult clinical neuropsychology. Her research focuses on how psychiatric conditions may impact cognitive health and psychosocial functioning in older adults. Dr. Callahan, welcome back. And I think that most people think of young children when you hear of ADHD diagnosis. Tell us, how can ADHD present in older adults and what effect does it have in our later life?
Thank you, Colleen. I will address those questions today in this presentation. I'm so excited to be kicking off this week, or this, I guess, 2 weeks of presentations. So thank you for having me. As Colleen mentioned, I'm going to be talking about ADHD in later life. And just before we jump right into it, I don't have any conflicts to disclose, but I do want to acknowledge that some of the research that I'm going to be talking about today received support from the Alzheimer's Association and the Canada Research Chairs Program. So what is ADHD? ADHD stands for Attention Deficit Hyperactivity Disorder. It also has historically been called ADD, or Attention Deficit Disorder. As Colleen mentioned, it's often considered a disorder of childhood, which is often surprising. It's often surprising when people find out that I am interested in ADHD, because I was trained as a geriatric neuropsychologist. And so essentially, I look at cognitive change in later life in older adults, and so people are always like, "Oh, ADHD, that's a kid's thing," and it is a kid's thing, and I'll get into that. But children with ADHD turn into teenagers with ADHD, and adults with ADHD, and older adults with ADHD. So these kids do grow up and they grow old, and their problems can continue into later life. And so ADHD is characterized by two main things. The first thing is the attention piece, so the attention deficit in ADHD. And what that looks like in adults is usually difficulty concentrating, being easily distractible, not being able to focus on things, and basically being forgetful. The second piece is the H, or the hyperactivity piece, which in adults looks more like impulsivity. It essentially involves difficulties controlling impulsive behaviors or acting without thinking. Now, individuals with ADHD can have both these problems of attention deficit and impulsivity, or just one of the two. So there are different subtypes of ADHD. So in that sense, strictly speaking, attention deficit hyperactivity disorder is a little bit misleading, because both don't necessarily have to be present. So as Colleen mentioned, it's a childhood thing, right? It begins in early life, and this is always the case. So ADHD falls under the umbrella category of what we call neurodevelopmental disorders, meaning that it's a problem that develops during the developmental period of early life. And many of the individuals that I have spoken to, when I ask them, when did these problems begin for you? Many of them will say, "Oh, I've always been this way. It's just sort of part of who I am." So in that way, the features of ADHD can almost be considered like personality traits in a way. In addition to beginning in early childhood, as I mentioned, these kids turn into adults and into older adults, and in that sense, ADHD is usually chronic. So not always. There are some children who more or less grow out of their ADHD, but in the majority of cases, it looks like children who have these issues will continue to have these issues throughout their life. However, the type of problems experienced may change. So what I mean by that is that in children, we see more hyperactivity and impulsivity, whereas in adults, the type of difficulties that seem to become more pronounced are more of the difficulty concentrating and forgetfulness. The last thing that I want to mention is that ADHD runs in families. When we look at children who have ADHD, 75% of children, so 3 out of 4 kids with ADHD will have a relative who also has ADHD, so a sibling, a parent, or a grandparent. I mention this because in my experience, many adults that I have talked to will only have become aware that they may have ADHD when their child is diagnosed, right? And so then the family doctor will give all this information about what ADHD is in childhood, and then the parent will say, that sort of sounds like me as well. And so there are recommendations from some experts that parents who are seeking help for their children for ADHD should also undergo some screening themselves. And the fact that it runs in families suggests that genetic factors contribute strongly to the development of ADHD, but of course, there's always interactions with non-genetic factors as well. So before I really jump into the heart of my talk, I just want to illustrate that the things that I've been talking about here, that the problems concentrating, forgetfulness, impulsivity, acting without thinking, these are core features of ADHD, but they're not unique to ADHD. And so what I'm showing you here on the y-axis is the number of people in a study sample, sample of a study that was conducted about 10 years ago. And on the x-axis is their total score in an ADHD rating scale. So the number of symptoms of inattention, distractibility, forgetfulness, impulsivity, the number of those symptoms that they endorsed, that they said, yes, I have difficulty with this. And you'll see that in this is a population study of just people out in the community. You'll see that the majority of this sample actually endorsed a medium amount of difficulties with inattention, distractibility, forgetfulness, impulsivity. The number of people reporting no issues with impulsivity or forgetfulness or inattention was very low. So almost no people said, oh, no, I don't have any problems with forgetfulness. I don't have any problems with inattention or impulsivity. That number was very, very low. Similarly, the number of people who endorse 20, 23, 24 symptoms on this rating scale is also very low. I'm just illustrating this because I just want to emphasize here that if there are things that I'm talking about today that resonate with you, that may be normal and doesn't necessarily mean that you have ADHD. When I talk about ADHD as a clinical diagnostic category, what I'm talking about is these people here who really report very high levels across multiple symptom domains. And again, this is a relatively small number of people. So it's estimated that around 3% of adults or older adults will fall in this very severe category. Okay. So again, thinking, well, if ADHD is a childhood disorder, like why did I decide to come and talk about it at the Kirby Expo, which is aimed at older adults, right? Why is it important to think about this? The first reason is that it often goes unrecognized in older adults for many, many reasons. The first reason is that ADHD is a relatively new disorder. It's a disorder that was created in the 70s. And so people who grew up, earlier than that were not really recognized as potentially having this disorder. And the fact that it goes unrecognized is meaningful. And it's important to address because when you look at, the benefits that can be gained from treatment, adults with ADHD really do benefit greatly from treatment, and they benefit from support mechanisms and environmental supports. And so the flip side of that is that when ADHD goes unrecognized and undiagnosed for long periods of time, there are few opportunities for them to draw from these supports. And so that's one reason I think it's important to raise awareness about what it is in adults. The second piece is that ADHD in and of itself is associated with other medical problems, other social problems, other financial problems, other mental health problems. And so, I really feel strongly that it's important to properly identify adults who maybe have ADHD, who may be struggling with these other issues, or who may be at risk of developing some of these other issues, in order to provide appropriate support to them. And then the third reason, and this is really the reason that is sort of most near and dear to my heart, is that the features of ADHD, like I said, forgetfulness, difficulty getting organized, difficulty maybe controlling some behaviors, can look like early signs of dementia in older adults. And this is actually how I became interested in ADHD. So again, I'm a geriatric neuropsychologist, and so all of my training is in cognitive change in older adults. But at the hospital where I was pursuing postdoctoral training in Toronto, I was affiliated with a memory clinic run by Dr. Sandra Black. And at the memory clinic, there were many older adults who were coming in for cognitive assessment because they were really, truly worried that they had early Alzheimer's disease. They were in their mid-60s and, had just maybe gone through retirement and were at home and were like, oh, I'm so forgetful at home. I can't seem to follow conversations. My wife literally just said something to me and I can't remember what she said. And so we're very, very worried they had dementia. And, we started screening them for ADHD, and it turns out that many of them did have undiagnosed ADHD that was sort of mimicking what they were worried was early dementia. And so I'm going to speak to that today, because that's really where my expertise lies. And so this is just a diagram illustrating the overlap between the features of ADHD and the features of many early dementia. So obviously memory difficulties are a core component of both, as well as other types of cognitive difficulties, controlling attention and controlling behaviors and thoughts. But there are other important features that are very common in ADHD that are also can be signs of early dementia. So these include sleep disturbances, depression, anxiety. These are very, very common in ADHD, and also are, for some types of dementia, sort of can be considered early signs. And so, it can be very difficult for a practitioner to tease apart, which is which. And so to illustrate this sort of tricky overlap between both, I'd like to share with you an email that I received from a woman right around the time I first moved to Calgary. She was a complete stranger. I suppose she found me just, doing a Google search and sort of saw some of my research. And she reached out to me completely unsolicited with this email. So she said, I am the mother of 3 boys. I have been diagnosed with anxiety and ADHD. 2 of my sons are currently on medication for ADHD. And my mother, who's 80 years old, is suffering from MCI. So MCI is mild cognitive impairment, and it's generally considered an early stage of Alzheimer's disease. And so the woman says, everyone assumes that she has Alzheimer's, but she has had no significant progression over the last few years. So her memory problems have not been getting worse. Her doctor has treated her with donepezil, so a cognitive enhancer for Alzheimer's disease. But again, no significant change. She's not benefiting from this ADHD, from this Alzheimer's medication. And so the woman says, I am convinced that there has to be some link between what I and my children have and what she has. Another link is that we all have restless leg syndrome, so a sleep disorder. I cannot find a way to pursue this, and everyone thinks I'm crazy to suggest that my 80-year-old mother might have ADHD. So this email really sort of, I think, embodies what my research program is all about, and why I'm passionate about this topic, right? This woman is, first of all, saying that she has several reasons to believe that her 80-year-old mother has ADHD, right? So she's saying, well, our whole family has ADHD. And as I mentioned, it runs in families. So she's right to sort of see a pattern there. She's also saying, her doctors think she has early Alzheimer's disease, but she's not really getting any worse. And she hasn't benefited from Alzheimer's medication. And so I feel like this email to me really illustrates how ADHD can mimic the presentation of Alzheimer's disease in older adults. And that even the practitioners and the physicians that are working with this 80-year-old woman, might not think to look for ADHD because, again, it's generally characterized or conceptualized as a childhood disorder. Now, what makes matters a little bit more tricky here is that there is some evidence that ADHD not only looks like dementia in some ways, but actually may be a risk factor for dementia or potentially an early stage of dementia. Now, I want to say here that this research is still very new. I personally consider it to be tentative at this point, but I think it deserves mentioning. What I'm showing you here on the y-axis is the risk of developing dementia over an 11-year span here on the x-axis. And this is a population study that was done about 4 years ago out of Taiwan. And basically what they found here is that individuals who have never received a diagnosis of ADHD, who don't have any history of ADHD, develop dementia at a lower rate than individuals who have received a diagnosis of ADHD at some point previously. So there have been a couple of other studies finding similar results, suggesting that ADHD may confer increased risk for dementia later in life. I can talk a little bit more if people are interested after the presentation about why that might be. But I did want to mention that there is some evidence tentatively linking ADHD to increased dementia risk. Now, on the flip side, some of my own research has investigated this question, and we essentially have found, looking at cognitive profiles, looking at brain regions, cortical thickness in different brain regions, we found when we compare individuals who have ADHD to individuals who have early dementia. I won't really go into detail about this slide, but basically what this is showing and what we found is that the patterns of brain changes that are associated with ADHD are quite separate from those that are linked to early dementia. And so basically what this is saying is that if you look at the brains, the brain patterns are quite distinct. And so there is some reason to believe that they are two very distinct features that don't overlap, essentially. So this is research that's still in very early stages, and that I'm obviously very excited about, very passionate about, and that we're continuing to pursue, as well as other people. I do want to spend a little bit of time talking about other important features of ADHD that distinguish it from dementia. So, notwithstanding this evidence that one might be a risk factor from the other, I do think that it's important to acknowledge that they do present, if you know what to look for, they do present very, very differently. And, there are facets of ADHD that are generally not typical of dementia and can be helpful when thinking about distinguishing the two. So the first one of these features is out of control emotions. This is also sometimes called emotional dysregulation, and it is very characteristic of ADHD and not so much characteristic of dementia syndromes. And so emotional dysregulation actually is gaining recognition among ADHD experts as potentially even like a core facet of ADHD that's separate from the inattention, separate from the impulsivity. It's its own core feature that's quite pronounced in ADHD. And so adults with ADHD will complain that they get angry, they get upset very, very easily and have trouble de-escalating themselves once they get upset. They complain about being very frustrated, having their routines interrupted because they can't seem to bring themselves back to a schedule. And this sort of feeling like they're always on the verge of an emotional meltdown, and that the emotions are very difficult to control. So this is sort of one example of a feature of ADHD that's, again, not particularly typical of a dementia syndrome. The second piece is interpersonal difficulties. So again, this is very, very common in adults' ADHD. Adults will often complain that they don't feel like they really fit in anywhere, or that they always seem to say the wrong thing or put their foot in their mouth, or inadvertently offend people. They feel like they should be better listeners. They feel like their romantic relationships never work out. If you look at divorce rates in ADHD across the lifespan, statistically speaking, adults with ADHD are more often divorced or living alone later in life than their peers. And part of the reason for this interpersonal difficulties is, if we think back to what are the features of ADHD, this difficulty controlling behaviors and acting without thinking, right? This also extends to talkativeness. So adults with ADHD are often described as being excessively talkative or easily interrupt other people in conversation. And so, this can put a strain on relationships on the communication front. Sometimes they're described as being impatient or careless in relationships. An interesting fact about adult ADHD is that many adults with ADHD will describe themselves or are described by others as being oversharers, or they'll be like, oh, TMI, like too much information. They casually divulge inappropriately intimate details of their private lives, and so that can create awkwardness in social situations and put a strain again on relationships. Again, if you think about the inattentive piece of ADHD, many adults with ADHD complain of not being able to pay proper attention in conversations, and that they feel like they can't really listen to what others are saying. And other people, partners or friends, may complain that their mind seems elsewhere, that they're always distracted in conversations, which obviously can lead to stress in interpersonal relationships. And then the last thing, obviously, is following through on plans or commitments. So adults with ADHD often have trouble following through on commitments, which again can put a strain on relationships. Inner restlessness is a facet of hyperactivity that seems to be more pronounced in adulthood. So when you think of hyperactivity in children, that really looks like running around, bouncing off the walls. In adults, the hyperactive piece of ADHD more often looks like an inner restlessness. So the adults that we speak to will say, I feel like I can't ever relax. I can't ever sit still. I always take on too many things. I always feel sort of overwhelmed by things. And, I can't sleep properly because my sleep is troubled by random thoughts racing through my mind. And, this inability to relax or sit still for extended periods of time is a feature of ADHD in adults that, again, is rather unique to ADHD relative to a dementia syndrome, for instance, and can be helpful in distinguishing the two. And so, again, some examples of what this might look like in an adult is, not being able to get through a movie, for instance, or not being able to read quietly for more than a few minutes because of this sort of need to be sort of get up and go, always on the move. Many adults with ADHD will complain of not being able to get things done. They can't seem to get started on a task. They will complain of feeling overwhelmed by the task list that they have to do for the day or for the week. Or on the flip side, they may say that they start all of the things that are on their to-do list, but can't manage to finish any single one. And so they'll get started and then get sidetracked, and then start a second thing and then get sidetracked. And they will describe feeling very frustrated at never being able to accomplish personal goals. And so, again, if we think about what ADHD is in terms of its core symptoms, it's inability staying focused, being easily distracted. This can be due to daydreaming with multiple thoughts coming in at the same time that interfere with one's ability to complete a task. This can look like forgetfulness again, not being able to finish a task because of getting sidetracked. It is sometimes described as, I'm just so forgetful, I can't seem to follow through on anything. And then the last thing that's very common in adults with ADHD is poor time management. So oftentimes adults will describe this experience as saying, I have no idea where the time goes. I've been, sitting, at my desk for 4 hours and I don't know what I've been doing. Somehow I've not been able to get anything done. I'm always running late. I feel like I can't ever, no matter how hard I try, I can't ever be on time. And so again, this is a very, very common experience in adults who have ADHD. I do want to just take 1 or 2 minutes to speak about ADHD in women specifically, because it does take on quite a different flavor in women than in men. So thinking about boys and sort of younger men who have ADHD, the sort of typical presentation is that they're disruptive, they're loud, they're boisterous, they have difficulty controlling their behaviors. It's a lot of externalizing disruptive presentation. Women and girls, on the other hand, tend typically, this is not always the case, but typically usually seem more distracted or disorganized or emotionally overwhelmed, or they seem depressed, like they lack motivation. And a large number of women and girls are not diagnosed, they're not identified as having ADHD for this reason, because their symptoms are less externalized and more internalized. And so because they're less disruptive, they're less likely to be identified as problematic, and they're less likely to be referred for assessment. Another reason that ADHD may look different in women is that females may develop social coping strategies that are very effective, that compensate for their difficulties. For instance, they may rely on partners to take charge of their finances or things like that. And so because there's someone else sort of taking care of certain aspects of their lives, that may mask or compensate for certain difficulties. I'll also note that ADHD in women is unique, as it seems to be more strongly linked to fluctuations in hormones. So there's quite a strong scientific literature suggesting that, well, quite a strong, maybe that's an overstatement, quite a strong relative to older adults, but in younger adults, there's studies showing that Symptoms of ADHD are significantly worse during puberty, linked to fluctuations in hormones during pregnancy. To my knowledge, there have been no scientific investigations into ADHD fluctuations during menopause, but I will say that I've spoken with some colleagues about this very issue, colleagues who work with older women with ADHD, and anecdotally, they've said that their clients have noticed increases in symptom severity around the time of menopause. And so for that reason, I think it's important to consider women with ADHD as sort of their own group that deserves unique consideration for these reasons. And the last thing I'll note about women with ADHD is that they are at particularly high risk for depression, low self-esteem, because a lot of their symptoms are internalized, meaning that, you know, it relates quite a lot to this emotional dysregulation piece that I spoke about earlier, difficulty sort of de-escalating the intense emotions. And there is an emphasis on the social piece as well, the interpersonal difficulties. So just to sort of summarize what I've been saying here is that, you know, thinking about ADHD in later life, there are these components of memory difficulties, attention deficits, and problems controlling thoughts and behaviors that are common to both ADHD and dementia. And these are the ones that are very tricky because they're the ones that can cause these issues with basically misdiagnosis or under recognizing ADHD. And they are the ones that, you know, were alluded to in the email of the woman of, you know, my mom has been diagnosed with early Alzheimer's disease because of these memory issues. I want to just emphasize here that there are these pieces on the outside of the Venn diagram in the non-overlapping regions. And so again, these lifelong feelings of being emotionally overwhelmed, feeling like a failure, feeling like you can't get things done, or that, you know, you just can't follow through, lifelong problems in relationships, these are very unique to ADHD. And if these are present, this is a strong suggestion that what we're dealing with here is ADHD that's maybe been undiagnosed. Dementia, on the other hand, I haven't really spoken about what dementia looks like because I do consider that many people are familiar with, you know, what does Alzheimer's disease look like. But essentially, dementia is not lifelong. It is the onset of new changes in sleep or mood or behaviors that do tend to get worse over time. And so again, you know, the appearance of new changes that are getting worse is suggestive that what we're dealing with is a dementia syndrome. So I just thought I would take the last few minutes of my talk to talk about how it's diagnosed and treated. I do get questions from adults about this, like, oh, I think I might have ADHD. What do I do? Or how do I find out if I have it? So ADHD is a clinical diagnosis, meaning that it is diagnosed by a clinician based on their interview with you. So there are no laboratory tests, there are no blood tests or brain scans that can reveal if you have ADHD. Currently, it is exclusively diagnosed based on an interview with a specialist. This specialist may be a family doctor or a psychiatrist. So a medical doctor, a family doctor or a psychiatrist or medical doctors. Or a psychologist who's not a medical doctor, but has advanced training in mental health. And essentially what this interview looks like is the doctor or the psychologist, the physician or the psychologist will ask you about what kinds of difficulties you're having, will ask you to describe what those difficulties look like, when they're occurring, in which contexts, and also how long they've been going on, right? Because again, for ADHD, the key piece is it has to have been lifelong. And so they may ask you for examples of, oh, well, what kind of a child were you, or what were you like in school? And, you know, how would your parents or teachers have described you? The second piece of the diagnosis is often includes questionnaires. So again, your doctor usually will ask you to fill out some questionnaires to get a sense of how many symptoms are present. So this interview is, you know, tell me about your experience. And then the questionnaires really aim to get at how severe, how many symptoms are you reporting in a quantitative sense. The third piece that is often included, and actually should always be included in the diagnostic workup, is to get an outside opinion from someone who knows you well. Now, this isn't always possible for practical reasons, which is why I said it's often included. But ideally, it should always be included. So, you know, basically, the doctor will ask you if they can contact your spouse or maybe a sibling to basically get their perspective of these difficulties, how long they've been going on, and, you know, just get a sense of their corroborating perspective. As I said, there are no laboratory tests that can conclusively determine whether you have ADHD or not. So there's no blood test, there's no brain scan. I also note here that cognitive testing is not necessarily a helpful element of the diagnostic workup. There is considerable controversy about this. Some doctors will require cognitive testing to be part of the diagnostic workup. Some experts, you know, say that it's helpful to corroborate or to support the diagnosis. So, for example, one objective of a cognitive test might be to determine whether there actually is an attention deficit on an attention test. However, this is tricky, and part of the reason it's controversial is that many adults with ADHD actually do very well on cognitive testing. In a quiet environment with no distractions, you give them an attention test and they often do quite well. And so basically normal scores on a cognitive test doesn't mean that a person doesn't have ADHD, right? You can have ADHD and still do very well. And the flip side is also true, right? And adults may have significant difficulties on an attention test without necessarily having ADHD. So strictly speaking, the diagnostic criteria don't include cognitive testing as a requirement. I will say that in older adults, it might be helpful to have cognitive testing to help inform whether there's a dementia syndrome that's present, because again, the key piece of dementia is that there are cognitive difficulties that are new and that are getting worse. So in that sense, it may be helpful to address the dementia piece if that's the question of, is it ADHD or is it dementia? How is it treated? Oral medication, so you may be familiar with it as Ritalin or Adderall. Oral medication is recommended as the first line treatment for adult ADHD. However, I will put a sort of a note here, is that there is severely limited data for adults over the age of 50. So older adults are underrepresented in drug trials, meaning that we don't have very much information or knowledge of how medication acts in this age group. There's also, for adults who are in the older age ranges, there are potential problems with polypharmacy and drug-drug interactions, because older adults typically are taking other medications as well, and so that's a consideration. And I'll also note that many medications for ADHD can raise blood pressure. So for individuals who already have high blood pressure or cardiovascular disease, there's a need for caution there. It's very important that that's a conversation that you have with your doctor. I won't really go into, just in the interest of time, I won't go into how these medications work, but if you have questions about that, I'm happy to address in the question period. The second line of treatment for ADHD is psychological therapies, so non-drug therapies. There are several of these available in Calgary. Again, I'm happy to speak to those if you have any questions about them after the talk. Psychological therapies are recommended for adults with ADHD, and they are generally shown to be effective. They usually involve reframing maladaptive thoughts and practicing regulating behaviors. So practicing regulating behavioral skills, learning and applying organizational strategies, practicing prioritization and organization. And then you'll also recall that I mentioned that emotional and interpersonal difficulties are often major issues for adults with ADHD. And so these types of psychological therapies will also usually involve some component of emotional regulation techniques that might look like mindfulness, self-acceptance, and there may be also a focus on interpersonal skill building. Okay, I want to touch here on why it might go unrecognized for so long, right? So again, coming back to my initial experience with ADHD was that, the older adults that were presenting to our memory clinic were worried they had Alzheimer's disease. And we were finding like, oh no, actually you've had undiagnosed, unrecognized ADHD for this whole time, basically your whole life. And so like, why does that happen? Why does it go unrecognized for so long? Well, the first thing before I get into coping skills is that, as I mentioned, ADHD was only established as a diagnosis in the 70s. So that's the first reason it goes undiagnosed, is that it just wasn't around as a diagnosis at the time that maybe it was needed. In addition to that, many adults who have been living and struggling with forgetfulness and disorganization have developed very strong coping skills and have relied on strong compensatory behaviors that have helped them basically manage in school, in their jobs. And so for those reasons, someone who has very effective coping skills may sort of just get by and may not be recognized as someone who's really struggling with ADHD. The second piece is that the presentation of ADHD is strongly tied to contextual factors. And if you think about demands in your life, in your context, those demands increase in number, scope, and complexity as we get older, right? As we get older, life gets more complicated. We have more things to manage. We have to, become financially independent, get a job, start to, raise our own children maybe, while gaining more relationships and more responsibilities at work, etc. And so all of these increased responsibilities may eventually, in some adults, lead to a breaking point where maybe their previous coping skills or strategies just don't cut it anymore because life has just gotten so overwhelming and so complicated. And related to this, difficulties sometimes may only begin to arise in later life when these previous, when previous external supports fall away. So an example of this is that symptoms may become exposed at retirement, when, a person who was always very heavily reliant on schedules and deadlines, all of a sudden those things fall away. And it's all of a sudden very difficult to get things done without any deadlines or any sort of external accountability. Another example might be the loss of a spouse due to divorce or to death. And, if that spouse was a significant source of support, it may become a real struggle all of a sudden to manage things on one's own. And life suddenly starts to feel very overwhelming. I just want to note here that depression and anxiety, as I said, are very, very common in ADHD and can mask some symptoms of ADHD. So I just want to note that that is part of the reason that it sometimes goes unrecognized. And it's important not to confuse problems linked to depression and anxiety to problems that are linked to ADHD. I know I'm I'm running low on time, but I do just want to take one slide to acknowledge that there are some facets of ADHD that are amazing. And I just want to like end on a positive note. Individuals with ADHD are incredibly creative. They benefit from hyper focus. When they're very interested in something, they can be extremely effective and productive on things that they love. They're generally described as very adventurous and, ready for anything, and risk takers, and very high energy people, spontaneous and able to think for themselves and, advocate for themselves. And so in this way, I think that, although we have been talking about ADHD as something that people struggle with and needs to be treated, I just do want to acknowledge that this was actually acknowledged in the New York Times just a few months ago, that, daydreaming and sort of letting yourself mind wander can actually be one of the best things you can do with your free time. So I just wanted to end on that very positive note. And also put in a shameless plug for my own research. If you are interested in participating in ADHD related research, you can just Google research at U Calgary and you'll be brought to this participate in research page. And then if you go into the search studies, you can just type in my name and you will see all of the research that we're currently doing related to ADHD. Some of the research questions that I'm interested in answering are whether treatments for ADHD work equally well in younger and older adults. I'm interested in determining the extent to which major later life events like retirement may lead to a worsening in ADHD symptoms. I'm also very interested in determining what factors help adults with ADHD to lead successful, fulfilling lives. And I also have a research study looking at whether adults with ADHD have certain dementia biomarkers. So again, that question of whether it's a risk factor for dementia or not. And I'll just end here by providing some alternative or additional resources if you're interested in knowing more. There are some talks on YouTube by Kathleen Nadeau, who is a clinician who specializes in later life ADHD. So she has a few YouTube videos up on this topic. This is a book that I would recommend that you can get off Amazon, ADHD in Adults, What the Science Says, that was published by 3 leading experts in the ADHD world. And then if you subscribe to the Wall Street Journal or to the New York Times, they have had a couple of articles on this in recent years in ADHD in older adults. So with that, I will end here, and I'm happy to have a discussion and answer questions. Thanks so much.
Thank you very much, Dr. Callahan. That was fascinating information. And for anyone that is interested in the resources that Dr. Callahan, I'm sorry, I'm just going to put you on gallery here. If anyone is interested in those resources, you can reach out and we'll make sure that we get that information to you. And again, we will be posting the video on our YouTube channel imminently, so that if you need to capture that information. Great information. Thank you very much. And, it's quite fascinating because, you're absolutely right. Is back in our day, nobody was really addressing ADHD in children, young people. They were just diagnosed as being, difficult children to deal with. And and then kind of went through our lives without having ever been diagnosed. And here we are now in our older years, and we're all going, aha, now I understand. So thank you very much. That was great information. And so some of the treatment that you referred to, the medications, sounds like that might not be as much of an option for some of older adults who perhaps are addressing high blood pressure issues as well. Are there any other medications that are maybe could be a little less invasive?
So in terms of medication, there are stimulant and non-stimulant medications for ADHD. most of the available ones, like Adderall and Ritalin, of all the types of medications there are, almost all of them, except for I think only one, are stimulants. So almost all of them are stimulant medications, and those are the ones that really affect blood pressure. I should preface this by saying I'm not a medical doctor, so I'm not a physician. So I would encourage you, you know, if you feel like these medications may be appropriate for you, you should absolutely talk to your family doctor about this. But so my understanding of these medications is that the stimulants are the ones that affect blood pressure. And so those are the ones that maybe you need to be more cautious with if blood pressure is an issue for you. I do not believe that non-stimulant medications affect blood pressure in the same way. And then I see in the chat, someone asked about side effects of these medications. So the stimulant medications, because they're stimulants, they can affect heart rate, again, blood pressure, shortness of breath. Some of the side effects that I'm aware of. But again, you know, not being a medical doctor, I would encourage you to speak to a physician about that.
It's interesting, you know, to think of being diagnosed as stimulant when you're hyperactive, but as you say, I think best addressed by your medical professional. Let's get to some of these questions because we do have some in chat and Q&A. Anonymous would like to know, what is the difference between ADD and ADHD?
Yeah, so ADD is not the diagnostically appropriate term. If you think about, you know, the correct diagnostic label is actually ADHD. ADD is sort of an older term that refers to basically the deficits that are, or problems that are focused on inattention, right? So again, if you think of what that acronym is, ADD is attention deficit disorder, and ADHD is attention deficit hyperactivity disorder. So ADD essentially just refers to problems paying attention, staying focused, without that element of behavioral restlessness, needing to be on the go, needing to move, feeling restless, essentially.
Mm-hmm. Yeah, and that was interesting that, you know, when one might feel that, well, I'm not hyperactive and I'm not, you know, not running around like crazy, there are other signs involved with the fact that inner restlessness, you know, like you mentioned, you know, the interpersonal difficulties, all of those things.
I'll also say that ADHD, even though the diagnostically correct term includes that H for hyperactivity, as I said, you can have ADHD with an inattentive subtype, right? So that terminology of ADHD is a little bit misleading, I acknowledge. You can have ADHD without being hyperactive, basically, is what I'm saying.
Mm-hmm. Linda has asked, any clinics or psychologists that you might suggest?
Yeah. Here in Calgary, there's a very good center that we're actually working with to evaluate some of their programs, called the Can Learn Society. The Can Learn Society is a not-for-profit organization that offers services to adults with ADHD in Calgary. Many of their programs have associated fees, but you know, I encourage you to get in contact with them to find out about all of their programs. But that's one that really, it's an organization that really specializes in supporting adults with ADHD. The second clinic that I'm aware of here in Calgary is the New Discovery Treatment Center. That's run by a registered psychologist, and again, she is specialized in supporting adults with ADHD, both with their sort of more ADHD symptoms, but also the interpersonal struggles, the emotional dysregulation. So those are two resources here in Calgary that I'm aware of.
Do you happen to have their contacts that we could maybe pop into the chat box for people? Or perhaps maybe send them to me afterward and I can send
Yes.
all of the registered.
Yeah, why don't I do that? I'll send you the contact information afterwards.
Absolutely. I think the people might be interested in having that information, make it easy for them. Anonymous has also asked, I missed the beginning of the yes, the program is being recorded, and we will have it up on our Kirby Center YouTube channel for you. We have a new digital manager who edits them and gets them up on YouTube for us. So it takes a little bit of time to get them up there, and typically I'll try to let you know when I have the link, when we know it is up there. So we'll get that to you ASAP. What are some resources to find out if you are ADD, ADHD?
Yeah, so both of those resources that I named, so the Can Learn Society and the New Discovery Treatment Center, I believe offer ADHD assessments. So you can get in touch with them if you're interested in getting an assessment. As I said, a family doctor can, is qualified to run through the diagnostic workup. I will say that many family doctors are, and there's evidence to show that family doctors are not comfortable diagnosing it always in older adults and adults and older adults. So if you speak to your family doctor about this, they may recommend an assessment with a psychiatrist or a psychologist if they're feeling a little bit uneasy doing it themselves, just because the presentation is so different in adults. So, I would recommend speaking to your family doctor if it's something you're concerned about. But these other resources also do offer assessment services.
I'm not sure if we answered Cecilia's question about what are the side effects of Ritalin and Adderall.
Yeah, I'm not sure I'm the best person to speak to that, but the side effects that I'm aware of stimulant medications involve, again, shortness of breath, increased heart rate, increased blood pressure, things like that.
Anything that's going to kind of rev you up a little bit.
Mm-hmm.
Lots of great accolades here. Jennifer Levina. Sorry, and Vi, thank you very much. Catherine, thank you for focusing on this area. It makes me feel slightly less alone. And Marian, very interesting information. Thank you. I think we've answered the difference between. And Catherine, a good question. Can you recommend any natural treatments that might help?
Yeah. I will say this is probably not the answer you want to hear, but diet and exercise, really, like eating well, sleeping well, and eating, sleeping, and exercising is the other thing.
All of those things that we know that we're supposed to be doing.
Yeah, the things that we know we're supposed to be doing. And, of course, I acknowledge, ADHD is associated with sleep problems, so it can be difficult to get a good night's sleep if you have ADHD. But exercise has been shown to be, really helpful for lots of physical and mental health problems, including ADHD. But the things about, there has been things in the literature about, sugar is going to increase ADHD symptoms, or food additives can increase ADHD. To my knowledge, there's no strong evidence for that. So, really the evidence says get a good night's sleep and exercise as much as you can.
And that's kind of a catch-22, because you can't sleep because you have ADHD or, other issues. And then, but that may cause you to be having the sleep issues. So it's a catch-22. Diane has posted the link here to Can Learn Society for us. Thanks, Diane. And she's also said, thank you very much. Great presentation. A couple more in chat here. Suzanne, is it valuable to be diagnosed officially with ADHD, or does the labeling go against one as you age?
That's very interesting. That's a very interesting question. I would say that if you don't feel like you need that label, I would say don't pursue it. I advocate for recognizing it and identifying it in adults and older adults specifically, mostly because the feedback that I've gotten from the people that I've interacted with is, the diagnosis for almost everyone I've spoken to really unlocks like an aha moment of like, oh, this explains so much about the issues that I've been having, and this explains so much about me and why I've been struggling. So I think for many individuals, it can really be sort of a light bulb moment where it provides some relief in a way, or some comfort. But I definitely don't think it's necessary to pursue if that's not how you feel.
The symptoms aren't that drastic. The thing of it is there are a lot of older adults these days that are still in the workplace. And, a lot of people may feel that there's, that stigma around being identified, and that they may not want to move forward. But I think these days that a lot of workplaces are more cognizant of dealing with people's mental health issues at work. So if it's something that is of concern that should be addressed, then perhaps you should. And so I've got another one here. Suzanne, again, it seems that my issues with ADHD decreased after taking Cymbalta, and very much so after dialectic behavior therapy. What do you know about the dialectic behavior therapy?
Dialectical behavior therapy is one of the recommended components of the psychological interventions that I spoke about. So, and I know that the Can Learn Society offers, and maybe this is going to be helpful to someone who asked about support groups. The Can Learn Society offers some group programs. It's a little bit more than a support group in the sense that it includes aspects of dialectical behavior therapy, cognitive behavior therapy. It's basically a psychological approach to sort of integrating, I suppose, a cognitive perspective on one's difficulties that can be very, very helpful. It's one of the evidence-based treatments for ADHD.
That's good to know. And Cymbalta, I've heard also that there are some medications that I think, because there is a fine line between depression, anxiety, and ADHD, there are some medications that are prescribed for depression that may help to alleviate those symptoms.
Yeah, I mean, when you think about, again, some of the core symptoms of ADHD are sort of difficulty getting started on a task. That's also an issue often in depression, often in anxiety. And so, when you think about the brain pathways that are involved in many of these mental health issues, dopamine is one of the pathways, or one of the molecules that is involved in many psychological disorders or mental illnesses. And so, it does make sense that being prescribed a medication that acts on helping depressive symptoms or anxiety symptoms by, working, for instance, on some of these neurotransmitters will also improve ADHD symptoms.
And again, talk to your doctor. Brian, overconsumption of caffeinated coffee sends caffeine to the brain. Caffeine takes over the sleep centers of the brain. So yes, you're absolutely right. It's best to kind of reduce your caffeine intake. I think that we've addressed most of the questions here. If anyone else has another question by Suzanne. Oh, Suzanne has asked to raise hand here. So let me just see. Suzanne, I've just allowed you to unmute there. Can you hear it?
Oh, thank you very much. It was such a good topic and so valuable, the information. Thank you, doctor. This is me to a T. I was recommended the Cymbalta as pain relief from the pain clinic here in Calgary. And it was truly incredible. The norepinephrine part of Cymbalta, that was something that I thought just so calmed me down so much. Just like what you'd expect when you're an ADD or an ADHD person, you know, you're looking for that calm, and that's what that did. So not only did I get tremendous pain relief, but I also got a beautiful calming effect. I just wanted to add that.
Oh, that's so lovely. I'm so glad that that was your positive experience. Thank you for sharing that.
Thank you, Kate. Thanks.
Thanks, Suzanne. And then again, take that to your doctor, and the doctor will let you know whether or not that's an appropriate. I'm just going to have the lower hand there. Okay, so we appreciate everybody joining us here today. If there's no further questions coming, Dr. Callahan, thank you very much. That was just fascinating information. And I think we could probably go on for a greater time. And you referred to your research, that it would be helpful if people do go to your site. And help to answer some of those research questions. Did you want to pop your website in your chat there before we go? And then if anybody's interested in doing that, then you can reach out.
Yeah, I will also put my, here you go. I put my email address and then my lab website.
There you go. So if anybody's interested, just jot down that information. We will, I'm just going to make sure that we save that. And so that if anybody needs that information following, by all means, reach out and we'll put you in touch.